Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello,
Hello.
how are you?
So good.
Awesome. So, thank you so much for being a part of this talk show. Let's talk about health. And this is a small platform that I started where I wanted to invite people from different health background and just get a chance to talk about health, healthcare system, how they got inspired in the field, and how they started their journey. So, thank you for being a part of it.
Awesome. Excited.
Yeah. Me too. I know we've been chatting for some time now, and I love talking to you and knowing that your wife is a Punjabi. So this is gonna be awesome. So thank you, and let's talk about health. So my first question to you is, what is health according to you?
Health it's a lot of different things. I think a lot of people just think about the physical part of it, right? The
Right.
lifting weights, exercising, stretching, things like that. But especially being older now too, and I'm getting up there. I'm 44. It's a lot different when I was
Right.
24, but it's so much more, right? That it's the mental part of it too, and that's such a big thing. And I'm glad that I think just in general as a society, I think we're putting a bigger emphasis on that, which has been really cool. So it's not just the physical part, but it's the mental part. And you need all of it. You need all of it to be in good health, I think. You can't just, lift weights and think you're okay. You have to be, you know, the mental side, you have to have everything. And I love that like now professional athletes of all
Right.
in all sports, right? They're talking more about that, and it's really cool because it's normalizing it. It's normalizing it. It's not just being physically fit, but you also have to have, up here, be strong as well. So that's been really cool.
Right. How did you start into behavior analysis, mental fitness, mental health? How did you get how did you get started in that journey?
It's because of a sandwich.
What?
Yeah, because of a sandwich. So I I had I had graduated from Sacramento State and got my degree in psychology, and I was still bartending and just not really knowing exactly what I wanted to do, and I was totally fine with that. And uh, I would just remember I started grad school, but I still didn't really have any idea of what I really wanted to do, and I was just doing like an open university kind of enrollment. I was like, this in a class, but I wasn't accepted into the program. One of my friends was, asked me to go eat with him, and we were walking to get a sandwich. And he's like, "Hey, you have your degree?" I'm like, "Yeah, I have my degree." He's like,
Right.
"You should work at my school." And I'm like, "Okay." I did not even question it. And so I,
Okay.
yeah, I toured the school. It was an amazing school for children with autism. I had never had any experience with that, and it blew me away. And I interviewed and got the job. And that was 20 something years ago because of a sandwich. And I think it was a pretty good sandwich too. And yeah.
I bet a sandwich that changed your whole life. It's ought to be a really good sandwich. So
Yes.
you just started in the school
Yeah.
and
Yeah, I started as what's called as a behavior technician. I was in a preschool classroom with probably 8 to 10 children who had been diagnosed with autism. And then I was promoted later. I was a teacher, so I had my own classroom, and I worked with children who were between the ages of 11 to 15 years old with severe. A lot of them had some pretty severe problematic behaviors. It definitely just shaped my life because it was so challenging,
right.
so rewarding, and it just I'm still here talking to you today because of it.
Yes.
It got me, almost 2 decades ago.
Can you tell me what's the role of a behavior analyst?
Yeah. So, well, first of all, applied behavior analysis, the easy definition, right, is just it's a science. The behavioral science is based on how we learn to change socially significant, things, right? And so we use it every day. In fact, I always talk to parents because they're usually unfamiliar with ABA, right? Uh, People kind of know what physical therapy is, right? They have some type of image, but with ABA, they really don't. But like today, you probably use at least 2 dozen different types of examples of ABA. Everything from setting your alarm clock, setting reminders, right? Um, if you got on social media today and liked a post, right, you're using what's called positive reinforcement, right? You're trying to increase, certain types of behaviors, right? And so the role of a behavior analyst really, at my old job, it was to supervise programs, and so I was basically quarterbacking everything for each client. I was making sure that the programs were where they needed to be. I was training the therapist. The big part, which formed my later my own company, was the parent training. I loved that. That was my favorite part of my job, was making sure that the parents were able to carry over what
Right.
we were doing, right? So that's a big part of it, and really just to kind of see the whole picture, right? And that's like a big thing, is uh, the therapists that were implementing the program sometimes they weren't always able to see the full picture. They were
Right.
sometimes, a lot of times, we were able to run the programs amazingly well and work with the kiddo. And sometimes they wouldn't be able to see why we're doing that, right? So in my head, okay, we're doing this as a building block for five other things down the road. So that's kind of the role of a behavior analyst. Uh, but it depends too. That's just one small area that we work in.
Right.
There's people who work in organizational, ABA, where they're, working with businesses. They're working with, other ones are working with adults and different populations. So it just depends.
Do you enjoy coaching parents and talking to them?
I love it. It's literally the reason when I started my current company, Omoto ABA Consulting, it was because of that. That's one of those things where I got the most reward from the parents. I knew with work,
Right.
you know, our the amazing therapists that I worked with, we would see progress with the kiddos. That was, they were amazingly trained. We had such a great reputation as a company, and I really knew we could do that. The hard part was sometimes with the parents, right? It's tough, especially when I was younger. When I was
Right.
25, 26, didn't have any kids. Uh, I looked really young. It's tough to tell a parent how to be a parent. It's like one of the most delicate things that you can do. But
Yeah.
I loved it because seeing that change in a parent, to me, it's just so rewarding, where I can see that they get it and they're starting to implement it. And then that's when I see the most progress. It's like with you as a physical therapist, it's you can do so much in your session, but if your patient is actually doing the work outside of session,
Mm-hmm.
right? And doing those squats and doing
Yes.
those exercises that they may not want to do, right? You're going to see so much more progress. And
Definitely.
yeah, and that's for me, that's where it was. It's just, I would work so hard. And even though it was challenging sometimes, the most rewarding things are always getting that parent who didn't want to participate, who didn't believe in what we were doing. That was my favorite thing, was when I was able to get them to be excited and to change their kind of the whole view. And I've seen so many of those parents become some of the best parents I've ever worked with, where it's just, you saw a big shift. And so, yeah, that's like, I love parent training. It's not easy, right? I'm a
Yes.
parent myself. I have a 5-year-old and a 10-year-old,
Wow.
and it's not easy. I tell everybody that. It's just like, I might be an expert with parent training, but I also know that it's hard, right? Just like with you might know everything clinically as a physical therapist to do, but I'm sure you're not always doing it. If you're working out or doing things, you're not. Sometimes you take shortcuts, or it's, I don't want to do all the stretches right now. It's not easy to, even though
Right.
you know, and you've studied for many years. it's just not easy all the time, especially when no one but yourself is holding yourself accountable. That's hard.
Yes, definitely. Is it like a slow process when it comes to parents, or they have you seen them being more open to change, being more
Yeah,
open and supportive?
it just depends, honestly, right? Just like with probably you've seen, you have some clients, some patients, right, who are just everything you tell them, they're like, okay, I got this, let's do it, give me more, give me more. And it's the same way in my field, right? It's I have people who are super excited from the get-go. They're like, hey, what are we gonna do?
Right.
How are we gonna get this done?
Yeah.
And then I have other parents where it's baby steps, and I have to take my time with them, and I have to.
Mhm.
Uh, I can't win a big battle. I know I have to do small things. So, for instance, I might have a parent where they're doing lots of things, maybe not correctly, right? They're picking up the kid when they're crying. They're just giving in to everything that the kiddo wants, right? They're accidentally rewarding lots of things, lots of problematic behaviors, right? I'm not going to try to help with 12 different things right there. That's just too overwhelming for the parent, right? I'm going to start off with one thing. I'm going to pick one thing that they can do, one win, right? And I'm going to go for there. And it just depends. It's like I said, I work with a lot of parents where they it's tough, especially if it's not their first kid, right? You're
Mhm.
going to be stuck in your ways, right? And that can be tough. That saying that it's tough. It's tough to teach an old dog new tricks, right? It's
Mhm.
very tough,
Yeah.
and so you have to approach it. You know, it's kind of like a dance when I'm approaching it. It's definitely a dance where I want buy-in, right? Whatever we're doing, whether we're a psychologist, if we're a speech pathologist, it doesn't matter, right? If you don't have buy-in from your client that's going to help out with everything,
Mhm.
the progress is going to be, not as great as it could be, right?
Do you think parents are more they see once they see the baby steps, they're more open to your techniques and
Totally.
uh, yeah?
Yeah, that's one of the things in in our field, that's one of my missions is really trying to, bring our science to the masses. It has such great application. We use it all the time, but just like I said, people aren't really aware of it. And so, that's one of the things that I'm really trying to do is show people how effective ABA can be used. And when you're using it correctly and seeing the results, and nothing sells it, nothing shows it in
Right.
progress, right? It's a hard thing. It's like with you. If you're doing all these stretches and all these exercises, but I'm not, I'm not seeing any progress with my hamstring. I'm like, I don't know if this is working. But if I start to see strength come
Yeah.
back, right, I'm probably more apt like, okay,
Yeah.
you know what? She knows what she's talking about. I'm going to keep doing this. I don't want to do it because it's tough, but I'm going to do it. And that's the same thing with us. It's when we show like the little baby steps where the kid for the first time, uh, when I used to be, working with children with autism exclusively, I remember like the first time like a kid would point for something that they wanted instead of crying and screaming. That was a huge thing where like, oh wow, okay, you could see it in the parents' eyes, right?
Right.
I remember the first time ever, uh, this mom, and she turned out to be. I worked with this mom for about 7 years,
Mm-hmm.
but early on, I remember this where this kid was having a really tough time, crying, screaming. He was just reaching for mom, and I just had the therapist that's like, try to make him say "mama," and she did unsuccessfully for a few times, and then all of a sudden he just said "mama," and the mom stopped and just started crying,
Right.
and I yeah, let him hug her, and then the therapist immediately was trying to do like another thing with the kid. I'm like, hold on.
Yeah.
And I asked the mom, was that the first time he's ever said that? And she's like, yes. So I was like, hey, do me a favor, to the therapist, like just back up a little bit, just give them, that's a huge
Yeah.
thing. And that really cemented that mom afterwards was just one of the best parents that, I've ever worked with. And I've worked with hundreds and hundreds and hundreds in my career. And it's one of those things, like you said, it's a, if you can see progress, you're going to be much more likely to want to continue, and do more. So, yeah, it's just, I never get tired of that.
I bet. Looking at that, you're doing an awesome job. I don't think I have the heart to even begin doing
I
that
think you
because,
probably could. You totally could. Once you're in that environment, you got the personality for it. You could totally do it. Yeah, people do say you must have lots of patience, and honestly, though, when you start to see those little kiddos, it really is just infectious. When you see
yeah,
them, it's hard not to just want to keep going. That's one of those things where you just uh, it's great. I love working with children. I love seeing that progress, and so I know other populations might need help, like
mm,
the older people, but I think that's just my sweet spot is just working with babies, toddlers, teens. I like that.
right. No, I know what you're saying. Like, I can see them happy, and babies love it when they come to the clinic, when the patient's kids come over or their
Hmm.
grandkids come over. We have a party. We leave everything, and everyone will just come together, and we will work out with them. We'll be like, okay, let's squat. So we'll do sit-ups, or everyone is doing sit-ups together. So we love kids, but in the beginning, it's so difficult that it breaks your heart when things don't go your way, or you're trying to help so much and you're not able to help as much. So I am just, I don't know if I could see that every day.
It's definitely hard. Like
Right.
it, I had to develop some coping strategies too, because
Okay. Yeah.
when I first started, I thought I could just just you know, I thought I could just help everybody. I thought like I could just do it, right? And it's a good passion, right? But you have to have that balance where you have to know too, where I can only help so much, right? I can only do this. If a parent keeps canceling on me, and I know we are the best fit for this, these this kiddo, it's super disheartening where it's just like, oh, if this kiddo was only going to our 3 sessions, we could do so much more. They keep canceling. They're only getting like 1 session, or every week, or if even that. I got better at it as I got older, but it was still tough. It was, I would still kind of take it to heart, and I would
Yeah,
try to hey, you're doing everything that you can. The team is fantastic. They're doing everything that they can. But yeah, you can only do so much, right? So it's a whole team approach, and
mm,
the family is a part of that team, a huge part, if not the most important part of that team.
definitely. Talking about family and parents, my mom is online right now. She's just sending hearts, but
Hello, hi, how you doing, Mom?
she's on a walk. She's just watching us. This is our walk time, early morning in India, so she's enjoying.
Oh, very nice.
Yes, that's my brother. We're gonna ignore him. But yes, can you tell me more about behavior analyst? We were discussing earlier before on call how it's so much of an umbrella, and what we discuss is just, or what topics you touch usually are just autism or
Yeah, that's
thing.
one of the things where the science wasn't originally it it was applied to individuals with autism, and
Right.
it's been amazing. It's one of the most effective, if not the most effective, treatment for individuals with autism, and that's based on decades of peer-reviewed research. But they do so much more. So like, when I was in grad school, I remember reading so many different studies. So for instance, uh, on food selectivity, right? So individuals who had a hard time eating or wouldn't eat, right? They would engage in packing behavior, or where they're just would just put food in their mouth but then not swallow it, and
Wow.
and they use the techniques and the science to help those individuals eat more. Uh, just in all types of things. I mean, billion-dollar companies use our science. Now, do you like Starbucks? Do you ever drink at Starbucks
Yes,
at all? Yes.
definitely.
Who doesn't, right? Yeah,
Yeah.
and that's one of the examples I love to give, right? So a billion-dollar company,
Yes.
right? I'm assuming do you have the app on your phone?
Uh, I do, but I don't use it so often. But I do have that. Yes.
Yes, I use it. I use it a lot.
Yes.
And basically that little stars, right? Every time you buy something, you get like stars, right?
Rewards.
Yep, you get rewards. More specifically, that's a token economy. That's the fancy word for it, right? Yeah. So basically, you don't get anything until you get a certain amount, right? You get 100 stars,
Yes.
you get something too. I just got 300 today, and I was so excited. It was like, yes,
Yes.
you know. And does it change my behavior?
Mhm.
Absolutely, right? There's been times where I got a new phone. My app wasn't opening, and so I had to use just my card. I was really uh, I wasn't happy because I didn't get credit for those stars, right? And it's like I really wanted them, and I'm a grown adult, but that totally affects my behavior, right? So yeah, we use it literally all the time. I mean, even the military is a huge example of that. They literally wear their reinforcement on their uniform, right? All their awards. My grandpa was a 30-year, sergeant major in the army, and he's an army ranger, and he had so many awards and all over himself, right? It's literally right. They use so many ABA techniques in the military. So yeah, every time it's tough because when I go anywhere, if I'm in my house, if I'm walking around, I'm just looking at the different ways that ABA is at play, right?
Right.
Anything that we do, the big thing that we do, right, is that we look at how we uh, maintain specific behaviors or increase them or decrease them, right? So you see that just all the time. I see that like uh, for people trying to quit smoking, right?
Mhm.
And so you look at how you do it. You can't just tell somebody, hey, stop smoking.
Yeah.
Okay, right? A lot of times you have to have what's called replacement behaviors. You have to like a lot of times people just need something in
Yeah.
their mouth. So I have friends who would, just have lollipops, or they had to replace it with something, right? Because they're just so used to, you know, a dozen times a day doing this, doing this, doing this, right? Going outside and doing that. And so you have to find a way to replace it with something that can, you know, meet that. And that's why you have the patches too. You have the patches because it still
Yeah.
gives you that same,
Mhm.
right? That same sensation, right? So you do that combined with doing that, then that that you that should help a little more, right? So
Correct.
yeah, there's just so many applications of it. It's hard for me not to see that when I walk out. It's the nerdy part of me because it's kind of hard to turn it off. I'm like, huh, you know. So yeah, it just you see it all the time.
I love it. You have to be so observant about these things. I never thought that. And you are so right. My friend, when he tried to quit smoking, yeah, first, when I was a kid and trying to be supportive, I used to go like, hey, just stop, you know?
Yeah, just
If,
stop.
yeah. And then I realized that it's addiction. You can't just
Yeah,
I started learning and reading more, and then I was like, okay, let's reduce it. And even after he completely stopped it, he still wanted the feeling. So he used to just hold it
yeah.
empty. Like he used to not light it up, but he used to just hold the cigarette and just carry it. But he was like, I'm just used to, like, if I don't do it, it's like a part of me. It's like a habit.
Well, I mean,
It's like,
picture how many probably thousands of times that he did that in his lifetime, and so you just get
right.
used, right? So anytime, in general, like anytime we're trying to replace a problem behavior, right? Anything, whether it's maybe drinking too much, it's very, there are some individuals that can just go cold turkey and stop. Like, there are some, right? We all know people that just like, all right, I'm just going to stop doing that, whatever it is. But that's not most of us. Most of us, that it's incredibly hard, right? Because um, I always tell parents the hardest behavior to change is our own. Like for my son, if I wanted to change like what he eats. I could just not give him ice cream, right? I could just, put all the sweets, throw them out or lock it up in our cabinet. I'm a grown adult. And so if I'm trying to change my eating habits, no one's stopping me, right? Except for me from going into that cabinet and eating. It's not easy at all. And so when you're looking at other things like smoking and, drinking, there's so many studies that our field has done on this. It's super, super challenging, right? You can't just tell somebody, it'd make your job a lot easier if you can just say, stop feeling your leg hurting. That's not going to happen, right? Just don't get hurt. Like, okay, well, thank you.
I wish it was that simple.
It'd be so easy. You could see like 100 clients a day.
I swear.
Yeah, but it's so methodical. Like for you, right? To see when you're working with a client, like what's like the average number of days or sessions that you might work with a client for like a leg issue?
2 to 3 times per week.
For how long do you think?
Give or take, it depends on insurance.
Of course.
But 6 to 8 weeks, and then we try renewing, getting more visits. So it's like 2 months, 4 months, approximately.
That's a lot, right? And so you're in, that's really intensive therapy, and that's the same way with our field, right? It can take some time, depending on what it is, right? I'd love that. I'd love if I could just do this and I could just instantly change, a behavior I wanted to change.
No, definitely. It takes time and patience. With physical therapy also, it takes so much effort, and you have to keep pushing them in a way that they see improvement, but we also see plateau, in the growth.
It's part of it. It's part of it, right? Behavior is not like, it's not always like that, right? It's like this, it plateaus, it goes down sometimes, right? And then it goes back up, and it's tough after that first time with you. If you're having me do a bunch of squats, I'm looking in the mirror, I'm like, well, my muscles look the same. It's like, well, that's not a really good, I can't judge after just one session with you. It could be an amazing session, but I can't judge my progress after that, right? It's going to take time,
Right.
So
That's why first session too seriously, because I know even if they're not judging, I'm judging myself to prove that yes, we can do this, we can bring a change. If we can just prove the first session and make them comfortable, then it's more easier for them to accept and come to physical therapy more often. So I try my best to, convince them in the first session, because a lot of them are very stubborn to, just therapy, or they're not so open to therapy.
Of course, yeah.
Change the mindset.
That's a big thing, right? And I love what you just said. And I think more clinicians just in general really need to focus on that. That was my big thing. That's what I would always, when I would mentor newer clinicians in the field, I always took so much time that first session. I might not even get to the kid, right? Talking to the parent, that's your first, view of what you're trying to bring, and a first impression is everything.
Yes.
And so I would spend so much time trying to win over and get them to trust me, and I might not even talk about goals or anything. I'm really just trying to get them, like what you said, I'm trying to get them to feel comfortable. I might ask them about what they do for a living. I might ask them about their family. Sometimes they'd be like, why are you asking me all these questions for like this? But it's really just because I want to relate to them. And then plus, I always use that information anyways. So if you told me what you did for a living, I put that in the back of my head, because like I said, you use ABA all the time. I would instantly just be able to relate that anyway. So it's, like, remember that last time you got your paycheck? Yeah, that's a form of ABA. That's a schedule of reinforcement, right? Basically, you're getting paid every 2 weeks. You don't want to like sometimes get paid every 2 weeks in one day, every 2 weeks in 2 days, right? You're used to a very specific schedule of reinforcement. Oh, cool. Remember when you're a computer programmer? Yeah, and when you're writing that code, you know what the end result is, but you have to write all these lines of code, and all those lines of code turns into this bigger goal, and that bigger goal goes into this other goal, right? And they're like, oh yeah, well that's what we're doing with your kiddo. We're gonna, I'm gonna help teach your kiddo how to imitate me, and hopefully down the road that'll help them, be better at imitating my vocals, right? And
Right.
so I love what you said. I always did that. I'm a firm believer that if you know doctors, clinicians, therapists just took more time focusing on that, you believe in your discipline, right?
Yeah.
I believe in my discipline. You can see results. It might not, you don't know how those results are going to be, but you can see results.
Mm-hmm.
But you that doesn't matter at all if they don't trust you, if they don't feel comfortable with you, and if they don't believe in you. That does so much. And so that's just one of those things where I can't say that enough. It's just like, be nice, you know,
Yeah.
be open,
Yeah.
listen. It's scary, right? It might be the first time anyone's ever had physical therapy.
Mm-hmm.
It might be a scary process going into a facility, and the person's already injured or not feeling well, and it's scary. They don't know if they're going to get better. They don't know if they'll ever have mobility again. And so you calming them down and just, you know, it is huge. I think every health professional, the bedside manner,
Mm-hmm.
right? Yeah,
Like you said, if we don't understand pain, then who else is? We are healthcare professionals for a reason, to understand what they're going through, that their family member may or may not understand, that others may or may not get, their spouses, their children, their grandparents, but they're coming to us for help. We have to relate to them in a way that they are not just and I think for all healthcare professionals, that they're not just doing their part. Okay, they're coming in, they're doing their session, just going. No, they have, I know everyone's kids, I know everyone who they're married with, who
that's
they are dating.
huge. I
Like,
love that.
it's amazing, and I love that now it's a community where they are friends with each other. My patients are becoming friends with one another, and we sit down. We first 10 minutes we'll just chat. Oh, what happened? You were reading this book. What was the end of the story? And oh, how are your grandkids? Did they come back from the vacation? So we'll just share a moment, and then while doing exercise, we'll focus. Then we'll be like, okay, let's do this tent, let's do this tent, and then we'll take a break, and then we'll talk again. We'll go grab some water. I have Indian snacks always in the pantry, so I'll get chocolates and snacks out. So it's more of comfortable, and I
Yeah,
have
but
this.
that's going to help you. That helps. You
Yeah.
start that session one, right? And that's going to help in that 10th session, that 20th session, right? Because they trust you and they feel comfortable. And all the education in the world, all the experience in the world, you might be recommending the best by the book techniques, exercises for your patient. But if they don't believe in you, they don't feel comfortable, it's not going to mean much. And that's one of the things I would always talk to the people that I mentored. Like, look,
Right.
you know, take time right now. This mom right now, this is our first session. You need to go make sure and talk to that mom because she does not feel comfortable right now. She says she's okay, but that's her body language. She, the things that she's been saying during the session, those are things where, you know, stop, take a second, and just
Yes.
like with you know, you took breaks to get water or eat Indian snacks. You can always go back to it. You're still going to accomplish what you need to accomplish,
Yeah.
right? You're not going to finish up what you need to finish up in one session.
Mm-hmm.
That's not, you know, it'd be nice, but
I know, I wish.
right, that's just not how it
Yeah.
goes. And so I love that. I love that mentality. I think, trust in your discipline,
Yes.
great, but then be a human,
Mm-hmm.
right? Because
Yes.
we've all dealt with professionals in different aspects of life where you can tell that we're either being rushed, right, or they're not listening, and it doesn't feel good, right? From the other side, it doesn't feel good at all, right? And I always remember that. I say, oh man, this doesn't feel good at all. I got to make sure, like even going over paperwork, right? When I used to do longer intakes at my last company, I would remember when I'm at the doctor's office and filling out all this information, and it's so tedious and it's so, and so I would, remember that. So when I'm going over the intakes, I'm taking more breaks. I'm just talking because it's not easy, and especially when, with the population I was dealing with, they were younger, right? So a lot of the families that I worked with, they were just finding out that their child was at risk or diagnosed with autism, right? And so I couldn't imagine how that goes, what goes through their mind. I've seen it many, 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 many times, countless times, but I don't know what that feeling is as a parent, right? I have two boys, but my boys don't have autism, so I can never know what that feels like, right? And so yeah, it's just really just trying to calm them and really just trying to just there's a process too, right? And so you, they hear about this and they get these services, and a lot of times they have no idea what any of these services are,
Right.
right? They're just like they're being told by some type of coordinator, like this is what you need to do. This is the you need speech services, you need occupational services, you need physical therapy, you
Right.
need ABA, and it's a whirlwind for these parents. And
Yeah.
you know, a lot of times people haven't stopped to even explain why we're doing these services.
Mm-hmm.
So when I was at my last company, that's what I would do. I would literally not even start with the intake paperwork. It was like, first, what questions do you have?
Right.
Do you know what autism is? And so many times the parent will be like, no, I don't. They'd feel a little embarrassed and like totally fine. No one, and I would just take steps. Like, do you know why I'm here? No, most people wouldn't know. I'd be surprised. Sometimes there'd be a parent like, oh yeah, you're applied behavior analysis, and they'd give me this whole definition, but that's super rare, you know.
Right.
So yeah, I just really just taking that time. I never took for granted that a parent knew why I was there. I had one case where I worked with um, the parent was another BCBA. I and I told her, I was like, hey, I'm gonna go over things, but I'm gonna still act like you don't know anything.
Correct.
I don't want to assume that, even though I know you're a colleague. I know that you know what I'm saying. I'm still going to assume that you don't, because I just want to explain. Because I
Yeah.
don't want to ever assume that you know everything. I don't, so I'm not going to assume that you do.
And it makes them uh, give a sense that, okay, this is really happening and it's not just an illusion. It's happening. So explain to them, make them aware. Okay, we're going to do this next. This is going to happen. This is what I'm going to feel like next. I wasn't aware what BCBA was until a few years ago, and it's such a new, fresh field that's coming, that's rising up. That's so important. I feel we should, like, it's a community. We all are here with the same goal, but we all play different parts, different roles in the same progress. So, getting to talk with you about behavior can help me implement so many things when I come across an autistic patient. So that really means a lot. Can you tell me more about like your case studies and how you approach to cases and how do you go about it?
Well, it's a little different now. So when I was at my old company,
Mm-hmm.
and just working with children who've been diagnosed or at risk for autism, the I do a lot of watching, right? you ask a lot of questions,
Right.
but the questions do help. So for instance, I might ask, how often is little Johnny, asking for your help? How many words is little Johnny like saying right now? And so I would always ask those questions, but what gives me more information is actually just the watching part, right? That's what we do. We analyze, we look at things. Because so many times a parent might tell me something,
Right.
but they're not, and they're not doing it on purpose, but they don't, uh, they might say something like this. Yeah, Johnny is this, he's always having tantrums. He has tantrums like all the time.
Right.
Like, right? And I would say something like, hey, well, he's not having a tantrum now, right? He's playing.
Mm-hmm.
But that gives me so much information. So I know now, okay, he's not having it while he's playing. Okay, under what condition is he having a tantrum? Because a lot of times parents won't give me that answer. They'll say, oh, he's all the time, all the time.
Yeah.
And so what helps me is if I can kind of step back and just like watch. So it's a combination. Then from talking to the parent, I know how accurate that parent is as well. Because that's something I have to uh, kind of quickly decide.
Yes.
Is that parent over telling me things, or are they underreporting, right? And both of those are problematic because if I just listen to a parent, I'm not going to be able to develop the best strategies, because if they say, oh yeah, he plays with me all the time. Okay. It looks though that in 2 hours I've been here, I'm not saying this to a parent, but I am thinking in 2 hours that I've been here, they have not once gone up to that parent, and they haven't gone up to the therapist at all.
Right.
So yeah, and so a lot, and then I'm kind of putting those in the back of my head, like, okay, so this kiddo's not doing that. They're not initiating play. They're not asking, adults to play. So I'm going to put that in the back of my head. That's something that we probably have to work on. And so I'm going to have in my head, I'm going to start formulating goals. Okay, this kiddo has only used 2 words for, in the past hour. All right, so that's probably another thing I'm going to do. But then the biggest thing too is I'm going to talk to the parent and about what is most challenging for them,
Right.
right? Because that's the big thing about ABA. We work on socially significant behaviors, and what that means is things that are important to you, right?
Correct.
Right?
Yeah.
And so, yeah, if touching the nose, identifying body parts, that might be developmentally appropriate, right? But if this parent is not getting any sleep because the kid isn't falling asleep until 1 a.m., that's probably a little more significant, right? So it's my job to also help that parent form a hierarchy of goals, like what's most important, right? Like with your patients, they might have a lot of different parts, like, oh, my elbow hurts, my hamstring is pulled, all this. But it's your job as a clinician, right, to help them kind of
No.
know what's
Going on.
We'll work on all of it, but let's work on this one first. Let's work on your mobility first, because you won't be able to walk. So let's work on that one first. And so that's what I try to do, and like for me, I'm always thinking about, I coined it, it's the 3 S's. So when I'm working with a family, anytime one of the 3 S's, I hear it, I stop and I want to work on that goal. So it's sleep, safety, sustenance, right? And I developed this years ago, but basically it is the 3 basic responsibilities that we have as parents, right? Keep our kids safe, make sure that they're fed, right? And make sure that they go to sleep. And it's so stressful as a parent when any of those 3 S's are problematic, because you have to do them every day, right? You might not have to go swimming like every day, right? So, that might be a goal of teaching your kid how to swim, but you're not swimming every day.
Right.
You're making sure that the kid's safe, fed, and in bed every day.
Yes.
And that's so challenging. And so that's what I do too. So I'll stop everything I'm doing and then work on that. That's one of the kiddos I used to work with. I remember, we were making great progress with her, and then the mom just mentioned, I always ask the first question of the day. I always ask, "How are you doing?"
Mm-hmm.
And when I ask, uh, the new parents will always tell me, "Oh, Sarah's doing great. Sarah's doing." I'm like, "No, no, no. How are you doing?"
Right.
Right? Because a lot of times as parents, we forget, like, we should care about that part too.
Mm-hmm.
And that actually gives me a lot of information as well. And so for that particular parent, she just said that she was exhausted because she doesn't get to sleep. And I was like, why? And she's like, well, we'll call her Annie. Annie, I sleep with her. She won't fall asleep without me.
Yes.
And I was like, well, what time does she go to sleep? Well, sometimes 2, sometimes 3 a.m., right?
Oh.
And this mom, the the dad was in the military, so for many times during the year, this mom was basically a single mom,
Mm-hmm.
and it was so tough. And
Right.
I asked her, I was like, "What would you want to do?" She's like, "I really just want to watch Game of Thrones, and I can never ever watch it." Right? She's with this kiddo 24/7, and that's all she ever wanted to do. And so I put everything else on the back burner and I worked just on that and
Yeah.
getting that kiddo. We just developed basically a better sleeping plan. And uh, my goal was to get the kiddo to bed by 10. Now,
Right.
obviously, for a little kiddo, I'd want it a lot earlier, but baby steps. So
Mm-hmm.
we got it to 10. And then after a few weeks, she loved it so much. She started getting the kid in bed like by 7:30, and it just affected the rest of her life
Yeah.
because your life is not just a parent, right? It's not. And the mom was so much happier because she was able to do things. She was able to, well, first of all, watch Game of Thrones. I still haven't watched Game of
Me.
Thrones, so I'm one of the few. Yeah, but that was just her happy place. And
Right.
as a parent, yeah, as a parent, you have to work at getting your happy place. You
Yeah.
can't just be a parent. You'll run yourself into the ground, and that's just, I've seen it too often.
Mm-hmm.
So yeah, that's basically what I do is I look for those types of things where I can help the parent the most significant thing that is important for them,
Right.
right?
Functional goals are very important. We all like our recent studies, and we are in a world where functional goals are so important, and like basics needs are needs are priority than luxury. So when even we start training our patients, we're like, okay, if you're able to walk, for me it's like, it's okay if you don't do a perfect 90-degree 90-90 squat. I'm okay if you're not doing a lunge that's 90-90. But if you're able to walk in the right way, if you're able to sidewalk because your subway is huge, if you're able to climb the
That's
stairs to go,
huge, yeah.
yeah, and it's our everyday life. So if you're able to go travel by subway just to come see me and go home back safe, that's a success for me. That's progress. That means we're doing it right. And then we jump into advanced things, like we're getting you running, hopping, we're doing more things, we're getting you in sports. But baby steps, like that's the core and the foundation. If that's good, strong, then we can go from
See,
there.
you'd make a wonderful behavior analyst. I mean, that's what we do. That's a hallmark of our science, really, is breaking big things into smaller steps.
Right.
And so that's exactly it. I told you everyone uses ABA whether they like it or not. I was like, well, that's actually, I know you just said that you don't like ABA, but you just did it. So it's just bound by, as as humans, we're bound by certain laws, right? And that's is one of them. I love what you just said. That's what we do. Breaking things up. I mean, it's, you gotta crawl before you walk, and you gotta walk before you run, right?
Yes. I think I'll look into it. I'll look into what ABA is and if we can do something about it.
Yeah. I mean, that's one of my missions, is really changing the perception of ABA,
Right.
right? I've said it for almost 2 decades. ABA, we're in need of a makeover, right? And so uh, it's it's our fault. it's public relations too, right? It's one of those things where if, uh, you know, a physical therapist, most people have an idea of what you guys do. Obviously, it's probably a very small picture, but they can picture it, right? Speech pathologist, they know that they work on speech. They know that, and there's obviously lots of things that a speech pathologist does, right? They work on the social components of speech. They work on articulation, intonation. They work on production. They work on, making sure that the kiddo knows how to use speech appropriately. That work in different modalities of communication, right? In ABA, a lot of people, if we were to walk down the street together and ask what's ABA, a lot of people, 5% of the people wouldn't even know what ABA stands for, applied behavior analysis, right? And I would bet that same amount of people would not really know what our science is.
Yes.
They've heard of concepts, right? The word positive reinforcement. You've heard of that, right? Yeah. And that's one of our terms, but it's also one of the most incorrectly used terms, but that's also our fault. We need to do a better job of teaching, yeah. My mentor, Dr. Len Levin, is like, I love it, Jay. You want to bring ABA to the masses.
Yes.
And yeah, that's what I want to do. I loved my 2 decades of experience working with children with autism. That being said, if you look at my Instagram page, my professional page, I actually don't mention autism at all.
Right.
And there's a specific reason, is because I want people to understand that it's not just for children with autism. It does an amazing job of teaching them skills, helping them with, behavior, increasing, desired behaviors and decreasing ones that we don't want. But we can apply it to so much more, right? So my new company is aimed at parents of all children. So I still will work with parents who have children with autism, but I'm going to work with everybody. I want to, because it's so useful and it's so needed. But as a science, we have to kind of realize that we have to be better about not getting bogged down in jargon, right? I really don't like using a whole lot of our jargon. If I'm talking to a parent, I will probably not use one ABA term, right? I see that in all the professions. One of my closest friends is my dentist, and when he's talking to me, he's telling me all the different teeth that he's going to work on, the procedures. I'm like, okay, like I have no idea what you just said, but okay. And so it's the same way. I don't want to be off-putting, right? I want, like you said, it goes back to our, how we started in the original conversation, which is you have to make people feel comfortable. And so if I do say an ABA term, I'm always very quick to explain it in layman's terms, right? Yeah. So we're going to, if I use the word reinforcer, I might say, hey, we're just going to use rewards.
Yes.
There's some type of payoff. No one works for free. I put it in that type of way. And then it's a lot more digestible, and not just, if I, as a professional in general, especially with a science that is still trying to find its way as far as getting people to know, like you said, it's like, I kind of know about ABA, but that's not your fault. That's our fault. We have to do a better job as a science, as a discipline, and as a community. We have to do just a better job of teaching people the right way, and not just, not being kind of like a know-it-all. We have to be relatable.
Yeah.
Right? We pride ourselves in being a science, and we are. We're data driven. We base everything that we do off of peer-reviewed studies, and off of decades and decades and decades of research. But that doesn't mean anything if people don't want to even have us at the table. It's tough.
No, I get it. Like when I'm explaining to my patients, I always have models of the knee, of the shoulder, the spine. I will bring it to them because I know that's how much layman I can get, but I also want them to know all the facts and all the technical terms. So I will go to them, I'll get the model and explain, hey, look at this muscle. So this is where your knee is attached. And when we do this exercise, this is what's going on. Your
That's cool. I
ACL.
like that.
Yeah,
You're teaching. You're trying to educate. I
definitely.
love that. Right?
Education, family education goes a big way. Once they're educated, I am confident that even if I give them home exercise, they will do it and they will be disciplined about it and they will see good progress. They come back to me and they're like, we did those exercises and you know what, I can squat and I can go really down and hold the squat and I'm able to do this exercise, I'm able to do push-ups. So it's amazing how much patient education, family education plays a role.
It's huge. It's everything. I mean, that's like, you know, I work exclusively now with parents,
Right.
and so I'm not in the field per se anymore. All my services are just telehealth, but
Mm-hmm.
that's what I do. My job now is to just make the parents understand. And well, this is why what happens. Like you think that you're you are you're ignoring the kiddo,
Mm-hmm.
right? They don't want to clean the room, and you think you're doing great because you're you left them alone, you walked away. But actuality, what's happening is you're still not cleaning the room, you know,
Exactly.
right? So you just walked away thinking that you're doing good, right? But what's happening is that your child now just knows that, oh, I do this and I throw, I start to scream and yell,
Yeah.
and you walk away. I'm no longer having to clean my room. So that
Yeah.
parent, I kind of show it to him. I was like, what did your kid just learn? And so I'll put
Mm-hmm.
it to him that way, like, oh, I just taught them to basically do that, and they get out of cleaning their room. Yeah, exactly. So it's just like, but I love that when you're doing the models and
Mm-hmm.
you're making it more accessible, right? Most patients of yours don't have the years of schooling and know about the anatomy. They might know where their knees at, right? They might know where their chest is at and where the hamstrings at,
Yeah.
but they don't know how all those muscles work. And so it's great that you're teaching them how that all relates,
Mm-hmm.
right? I didn't realize, how much, your back is related to your legs. I was just like, yeah, yeah, and someone was having me do all these stretches for my back because I was experiencing a lot of back pain, and conceptually I wasn't understanding until that person started to explain why and show me the muscles. Like, oh, and that's my role as a BCBA, is to help link those. And
Yeah.
to me, it's super apparent, right? To you, it's super
Mm-hmm.
apparent where how the body works. And for me, it's the same way with behaviors in the environment. It's very easy for me just to see how that. Well, if you do that, then this happens, right? But most people don't see that, and so that's my job, is to slow it down
Yes.
and to, like you did, you took a model and showed that person, right, of how the muscles work in the knee and how that works. And I do the same thing, except I just do it with their
Yes.
kids. You do this is going to happen. Do you want that to happen more? Do you want them to continue to scream every time you ask them to do something? And obviously no. you know
Do you do a lot of do you talk a lot with the parents and the patients, or do you just do a lot of play therapy since they're kiddos?
well, for me, I don't do it's just the parent. So basically, I would be doing this right now, right? Just be all telehealth. And uh, the parent would basically kind of go over what is the most concerning thing, for them, right? And so, I have one child now where they're, having difficulty following instructions. And so what I'm doing is giving them the roadmap. Okay, this is what happens when he does this. You need to do this, right? And then helping them see why he's doing that as well, right? And uh, it's that's one of the great things about COVID is that I got, I had to get good at doing this. When
Yes.
when this first happened, when the pandemic had first happened, and we switched to telehealth, none of us had ever done it. I didn't know how to do it. I didn't know how to teach, because
Yeah.
you think it'd be right, the same, but there's so many things that are different yet the same. And so over the years, I got really comfortable and really creative about how to do it. And at first we tried working with the kiddo like this, and like, oh, that's not going to work. And what we started to do is I was having the parents do it. Okay, so get behind him, and you're going to help him put his shirt on. Okay, so use your right hand. Okay, and take it, put it over his right hand, and that was way more effective,
Right.
right? Because a kid, so many kids, even my kiddo, he's 10. He doesn't want to, pay attention to me if I'm talking to him on the video. I have him for about 5 minutes, and then he's done. So
Yeah.
yeah, these last few years, just really help people know how to use this type of technology,
Mhm.
and B, I got more comfortable about how to use it. So
Right.
just I can quickly show them a model on the TV, or if I have my kids available, I'll use my kids as models. I would show, even at my old company, I would do that. I would show them, oh, here's what you want to do it this way. Or I'd use dolls, I'd use, my kids,
Mhm.
you know, stuffed animals, or anything I had available. Yeah. So it's been a different experience, especially as it's a lot different for being a first time, business owner, and uh, navigating that. It's been a little different, but it's just been an amazing experience this past year.
I bet. Are you enjoying it?
Yeah. I mean, it's so hard in different ways. Before I would get stressed out about, having too many clients. I was like, oh, and I took it for granted. I always had clients. I was like, oh, Jason, here's another client. I'm like, oh, okay. And now I
Mhm.
have to do the other part where I'm having to seek out clients and seek out, business, and it's just given me such a big appreciation
Right.
about, the owners of my old company, and just that perspective, because I never had that. I appreciated it, but I didn't get it until I, had to do it
Right.
myself. It's a lot different, and people at my old company, they knew what I brought, right? All the parents, some of them, like I said, I worked with them for years.
Yes.
Here, I have to show them, right? I have to, like, and then first off, I have to actually show them, that there's a need. So many parents uh, are having a tough time, and are just
Yeah.
kind of, they're just living with that. They don't realize, oh, I can go and get professional help,
Yeah.
right? If your tooth hurts, I should go to a dentist, right?
Mhm.
I need to go get that fixed. If your plumbing is like leaking, hey, I can go and call a plumber.
Right.
If your kid is having a tough time and you don't know what to do, so many times a parent, A, doesn't realize that there's help available, and then B, who to call. And
Right.
so, that's what I'm having to learn, especially, being on social media as much as I am now, which I've always been on social media, but it's a different thing when you're having to do it to educate, to bring an understanding, to to get your personality out there, to to show that you're someone that they want to work with. It's a lot. I didn't realize. I thought it would be hard, um, but I didn't realize how hard. But at the same time, it's um, as a parent, I've never had this much time with the kids either, right? I can do so many things because it's, I don't have to ask anybody for time off. If I want to, like today, I, joined my boys for their Friday flag, where the whole school gets out, and I don't have to ask anybody. I can just, like, okay, I'm gonna go. Yeah, and just be in their lives, right? Because
Yeah.
that's one of those things they always say as a parent, that kid will never, care about the client that you had. They care about the time that you spent with them. And, you know, I got to practice what I preach. I always
Yeah.
talk about parents like, hey, make sure that you take time for the kids, make sure you take time for yourself. So I'm doing my best to kind of listen to myself, which is not easy.
Yeah. I bet. No, creating awareness is so difficult. And speaking of field that don't, they're very new, not a lot of people know about it. Creating awareness about those fields is even more difficult because you have to justify why you exist. It was the same for physical therapy. Just until a few years before, no one even knew what rehabilitation sciences was. Everyone knew, oh, surgery and you're fixed. Now things are changing. You do physical therapy not just after surgery, but you do it before surgery. You do it for prevention of surgery. So there are so many things that are changing, and not a lot of people know about it. So we need to talk more, educate more, create more awareness. And that is why I wanted some behavior analysts to explain it to me to begin with, and to everyone, how their work actually works and how they make a difference in this field of healthcare. So I love it. I love what you're doing.
Well,
And
thank you.
your heart is in the profession. Your heart, you have all passion and you are preaching what you're saying. So that means you definitely have the discipline and the love for the field. So I can see that.
Well, thank you. And like, people like you, that's just helping everybody, right? I mean, having this series and just, speaking to so many different people, it'd be so easy for you just to interview physical therapists, right?
Right.
But I love what you're doing. You're bringing, we're in one field, really. We're in the
Yeah.
health field, right? We all serve different roles,
Yes.
but it's great because education is huge, and I love that we're, learning about different professions and, the roles that we all play is it's so valuable. So I love and appreciate you giving us this opportunity.
Thank you. Thank you so much. What is one thing that you would say to 18-year-old Jason?
You know, have a plan, uh, but don't be afraid to deviate. I had my
Wow.
plan was, I was gonna have my PhD by 25. I was gonna have my first kid by 26. I had all these, plans in my head. Yeah, I would just say, hey, have a have a guide, have just a rough outline, but don't be so hard on yourself if you don't follow exactly that. I had no idea I was going to be, moving from Sacramento to San Diego and being in this profession because, like I said, of a sandwich, and yeah. So yeah, I mean, it's one of those things I think. It's good advice for anybody, right? Just it's
Yes.
good to have goals, but you don't need to necessarily have a timeline, I think. It's just if I get my PhD when I'm 55, cool. If I don't, you know,
Yeah. Life has something better planned always.
it does, you know. And so yeah, I can't wait, for this next chapter of my life, and coming in on my first year of being a business owner is it's it's I don't know. I mean, 3 years ago, I didn't know I was going to be here. I
Yeah.
thought I was gonna in my career at my last company, and so yeah, keep the opportunities open and keep the
Yeah.
doors open.
Right. Talking about next chapter, what are your next projects and what do you have next plans on your list?
Um, you know, a big one that I've been trying to develop right now is just a toilet training protocol. So I have toilet trained just hundreds and hundreds and hundreds of kids in my lifetime,
Right.
and I'm in the process of just finishing up a protocol
That's
to,
cool.
yeah, to help parents, out and, just provide just another
Mm-hmm.
service. And so, been working on that. And it's just tough to try to like balance everything. You think you have so much time, but then there's just so many things, especially just you know, navigating social media, meeting with people and, balancing in the clients. It's just, I can see why, they have social media managers as positions. I thought, oh, it's so easy. Just post. It's not that easy.
It is not.
No, I wish it was. So, but yeah, I mean, that's my big goal. My other one is, hopefully is to, maybe start, training as well. So
Right.
staff training, I used to love that when anytime I got the opportunity to help train our staff, I love that. So just, presenting about, specifically about how to talk to parents, and training parents, is something I'm pretty excited about, and just, those opportunities. So it's just, it's a lot because as a first time, entrepreneur, it's really easy to just try to do everything, and then I have to remember, hey man, you gotta small steps, right? Small steps, right? And just know that there's gonna be a big thing for me. So yeah.
Yeah, I'm excited. I'm so excited to see where this leads you. And everyone who's out there in California, especially in San Diego, please go visit him. But I know you do telehealth, so even if you're not in San Diego, you can sign up and just know. And I bet you'll be more than happy to start by just patient education and just explaining what ABA role is and how helpful it is. So thank you so much for taking the time today. And I love that I see your videos all the time with your boys, and I can see that you are going to be successful by default because you
Oh,
really practice.
thank you.
And I'm so excited that you're starting this new business, and it's gonna go a long way. So, and I can't wait to meet your Punjabi wife. I just want to meet her and take her out for some good food.
Hey, whenever you're on the West Coast, hey, definitely look me up. So
Definitely, I'll hit you up and we'll catch up for sure.
awesome. Thank you so much.
You're most welcome. Well, have a good night. Thank you for giving me your time.
Thank you.
Bye bye. Take care.
See ya.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.